Hi, I'm Christine Huber, an LVAD coordinator at Barnes Jewish Hospital. Today I am going to demonstrate how to perform our op-site dressing change for driveline sites. Typically, this dressing is changed once a week, but can vary depending on the amount of drainage or personal needs. For this dressing change, you want to ensure you have the appropriate setting and supplies before beginning. An ideal setting would be somewhere the patient can lie down and allow easy access to the abdomen or driveline exit site, such as a bed. If the patient is performing this themselves, it would be a good idea to have a mirror and can be done lying down or standing. You also want to make sure that the door remains shut, no pets are in the room, all fans are turned off, and any vents are closed during the dressing change. Supplies include face masks for everyone in the room, including the patient, ChloraPrep swabs, clean gloves, op-site dressing, and Metapore tape. You may want to designate a specific table for dressing changes to help keep supplies together, but this is not required. Whatever surface you plan to use during the dressing change should be cleaned with an antibacterial spray or wipe such as Clorox or Lysol. Have the patient lie down or recline in a comfortable position that allows access to the abdomen. Everyone should put on their mask before opening any supplies or removing any dressings. Wash your hands and put on clean gloves. Now we are ready to remove the old dressing. Gently pull the adhesive up from the edge while bracing the skin and avoiding touching anything covered by the dressing. Remember, you have clean gloves on and the driveline site is sterile, and you do not want to contaminate anything. Continue this around the entire edge of the dressing until the dressing removes freely. Dispose of the old dressing. Upon removing the dressing, observe for any drainage. You will want to note color, consistency, amount, and if there is any odor. You also want to look at the driveline exit site for any redness or irritation. Now it is time to begin the cleaning process. Take the ChloraPrep swab and squeeze the two wings until you hear a snap. The cleaning solution will move down to the tip of the applicator. Depending on your dressing supply company, the solution may be clear or orange tinted. We will clean by making concentric circles, which means you will make bigger circles as you clean and move further from the exit site. Starting at the very center, you want to press down directly over the exit site and scrub back and forth for a few seconds. Then, start on one side of the driveline and circle around the driveline until you reach the other side. You want to press into the abdomen slightly while cleaning. Continue doing this at least 4 more times, slightly overlapping the previous circle. The idea is to clean the entire area that would be covered by the dressing. Allow the abdomen to dry. Do not waft, fan, or blow on the area to speed up the drying process. This should take a few minutes. Once the abdomen is no longer shiny, you can proceed with putting on the dressing. To cover the driveline site, you will open the op-site dressing. Once removed from the package, you will notice a 1 and a 2 stamped on the dressing. These are done by the manufacturer to help guide the application process. Pulling the 2 white flaps apart, you will lay the dressing over the exit site. You can place it in whichever direction is most comfortable as long as the driveline exit site is covered by the white honeycomb square. Discard the white paper flaps. Press the dressing onto the abdomen to help secure the dressing. On either long edge of the dressing there is a small tab. Pull this tab back to expose the Tegaderm dressing, and while pressing down on the dressing to further secure the dressing to the abdomen, discard the piece you removed. To provide an additional seal, tear off a single piece of tape for where the driveline exits under the dressing. This area is prone to movement and lifting, so you want to place the tape over the driveline, pinch it around the driveline, and then press the tape onto the abdomen. Some patients choose to date the dressing so they know when it is due to be changed again, but this is personal preference. You're finished with the dressing change and can remove all masks and dispose of supplies. This procedure does not require sterile gloves or clean gloves. To remove the Hollister patch, squeeze the sides of the housing as directed while simultaneously pulling the zip tie out. Then remove the gauze and the driveline from the anchor and carefully remove the patch from the skin. Discard the gauze and the old Hollister patch. The next step is to apply the new Hollister patch. Supplies include one Hollister anchoring device and a piece of 2x2 gauze. The purpose of this device is to anchor the driveline to the abdomen to help minimize movement of the driveline that can lead to potential driveline infections. This anchoring device also helps prevent trauma to the direct exit site of the driveline. Instead of the driveline being tugged on or snagged at the exit site, it is limited to where the anchoring device is placed. This device can stay in place as long as it is adhering to the skin. Some patients change this the same day they change their driveline dressing to create a routine, but that is optional. When choosing placement for the Hollister patch, you want to ensure you maintain a nice bend on the driveline to avoid any sharp kinks that could damage the internal wires. Additionally, you want to follow how the driveline exits the body to avoid unnatural bends or twists in the driveline. You will want to angle the anchoring device on the skin so that the driveline will lie within the zip tie closure. Again, to avoid any unnecessary kinks or bends. You also want to routinely change the area that you place the Hollister patch to prevent skin breakdown. The amount of slack you place between the exit site and the Hollister patch is personal preference, but should not be so tight that it pulls on the driveline. Keep in mind, you may need to make adjustments based on the clothing you will be wearing. Open the Hollister anchoring device package. You will notice there are two types of adhesive on the back. One is paper and the other is a waxy-like material. Both help secure the driveline in place. You will note there is a zip tie-like closure. This is what will hold the driveline in place. There is a small square piece of plastic that houses a small slit that allows for the tie to pass through. Unlike a zip tie, this securement allows you to loosen and tighten as needed. On this housing, there are words, "Squeeze sides to release." This is the mechanism you will use to loosen the zip tie closure, to readjust, or when changing the Hollister patch. Once a position has been decided, remove both backings from the adhesive and place on the skin, pressing firmly to secure. Open the 2x2 gauze and place this around the driveline where it meets the zip tie. This gauze helps provide protection from the rigid plastic of the zip tie and prevent breakdown of the white silicone coating. At this point, you will loop the zip tie around the driveline and gauze and slide it through the slit. Be sure to adjust the gauze so that it remains around the driveline where the zip tie is touching it. It is very common for this to move around while tightening the closure. You want to make sure the closure is tight enough that the driveline does not slide freely. If it does, you need to tighten it until you are unable to move the driveline back and forth in the zip tie. The tail end of the zip tie can be tucked underneath the housing in a small slot. It is important that you never use scissors near the driveline under any circumstance. Using scissors near the driveline puts you at risk for cutting wires within the driveline. If needed, you can place a Band-Aid or a piece of tape on the end of the tail to help minimize skin irritation from the rigid plastic.